Hey guys, it's Allison Lehman, founder of Throne Room Ministries, and we are here today for episode 2 of our very first series in our very new YouTube channel. This series is called The Church and Abortion. So as you see, I am not in the awesome studio I was in last time. Some of these episodes we will be in studio as I will be interviewing folks. And then there's going to be some, which my goal is for these videos to not be as long, but there's going to be some that's just going to be just me. I'll probably be right here in my office. And this one we'll be talking about some pretty hard stuff. So, not every episode is going to be all fun and all bubbly, because here we are, we're talking about abortion. Abortion's heavy. Abortion's hard. There's lots of confusion, lots of misconceptions, and this episode is going to be one of those. Just to recap at our first episode, we had Carrie Jernigan with us, and we had an awesome time talking about what the Lord spoke to me. That is the root to the abortion crisis. And it's actually not abortion. The crisis is that we have lost our identity. It is an identity crisis that not only women of the world, but the daughters within the church are also experiencing, where we are looking for worldly things to fill the voids and the desires of our hearts. And I shared a little bit of my testimony of how that looked like for me prior to Jesus totally bringing me back to life and transforming my family. And Carrie spoke a little bit about her testimony and how, you know, even as Christians, we can still seek for other things, and they may be even good things, to fill the voids, to give us purpose, when truly we need to seek Jesus for those voids, because He is the only one that can forever fill them. Amen. So I am so excited and proud of that first episode. Carrie is an amazing woman of God. This one is going to be a little heavier. I'm going to try to end it sooner. In the third episode, we're going to be back in studio, and the episode is going to be But What About the Children in Foster Care? So I'm so excited about that one. You know, foster children are near and dear to our hearts. But without further ado, let's get started on this hard subject. It's hard, but I believe that with love, the church can and should talk about these things. We are called to shed light into dark places, and I believe that's what the Lord's called me to do, and that's why He's planted me right here in this pregnancy center where I'm working at. So today's episode is going to be called But What About? And we're going to be talking about those subjects that dominate the abortion discussion today. So episode 2, we'll talk about the rare and hard cases that dominate the abortion discussions. Fetal abnormalities and danger to the mother's life. We will also discuss the sensitive topic of miscarriage and the need for clarity and compassion among healthcare professionals and the law. So I've got some points here. I'm going to try to stick to these points to keep this video not quite as long as the first one. But the first one, I've broken this point into two perspectives. And the biblical perspective here is that the enemy comes to steal our peace, to destroy our unity, and to instill fear and confusion. And I believe that that is what he is doing today. I don't know if I've said this in the beginning or not, but I believe strongly that regardless of who won the election this year, I felt that this series needed to go forth because we need to change how we view abortion. And as we're seeing right now, a lot of decisions are made out of fear and confusion and lack of clarity. And we should not base our decisions out of fear. We should base it out of spiritual discernment and logic. The medical point I'm going to be making here shortly is that miscarriages, ectopic pregnancies, stillbirths, fetal deaths, and C-sections are not abortions. I repeat, they are not abortions. For the purpose of the pro-life movement and the state laws. These are not abortions. And we're going to go into all that. I know what the medical billing codes say. I know what the outdated medical terminologies say. But these are two totally separate worlds that the enemy, and for the reasons of political gain, they're trying to merge together to cause confusion and fear. So we're going to talk about that. But first, there are some scriptures I would like to share with you guys today. The first one is John 10:7. It starts with 7. I'm going to read through 14. And it talks about the good shepherd. Therefore, Jesus said again, very truly I tell you, I am the gate for the sheep. All who have come before me are thieves and robbers, but the sheep have not listened to them. I am the gate. Whoever enters through me will be saved. They will come in and go out and find pasture. The thief comes to steal and to kill and destroy. But I have come that they may have life and have it to the full. And some variations say have it more abundantly. I am the good shepherd. The good shepherd lays down his life for his sheep. The hired hand, listen to that, the hired hand is not the shepherd and does not own the sheep. So when he sees the wolf coming, he abandons the sheep and runs away. Then the wolf attacks the flock and scatters it. The man runs away because he is a hired hand and cares nothing for the sheep. I am the good shepherd. I know my sheep and my sheep know me. Just as the Father knows me and I know the Father, I lay my life down for my sheep. So church, in these scriptures, and I believe we can put this into perspective right now, Jesus is the good shepherd. He directs us to still waters. He guides our steps. He cares for us. He lays down his life for us. He holds us in his arms near his heart. He loves us. So it talks about Jesus, the good shepherd. And then it talks about the hired hand. And, you know, regardless of if you're red or if you're blue, I can really see the government officials, the elected leaders, as the hired hand. You know, no matter their religious background, maybe they are men of God, maybe they are women of God, but you see, these officials are going to come and go, just as they did in the Bible, just as they did in Judges and in Kings. The government officials will come and go, but Jesus is constant. He is our constant and our lifeline. So often what you see in politics is, you know, our officials, they say what they need to say to get in. Some of them truly love America. Some are truly want to gain for their own reasons. But regardless of that, they will come and go. And, you know, when they go, we'll hear no more of them. But Jesus is the steadfastness. He will always stay, and he is who we should ultimately cling to. A couple more scriptures, 2 Timothy 1-7. For God has not given us a spirit of, you guessed it, fear, but of power and of love and of sound mind. Jesus, God, he gives us sound-mindedness and love and power. So if you're making decisions out of fear and confusion, that is not of God, right? 1 Corinthians 14:33. For God is not a God of disorder, but of peace, as in all the congregations of the Lord's people. So in this scripture, it's talking about the church of Corinth here. And this book is addressed to the new church, where there are lots of zealous people on fire for the Lord, men and women. But these men and women, they came from a pagan background where you worship women, where you worship sex, where you worshiped idols, you know. So the women in this church were being very loud and very disruptive, and it wasn't because they meant to cause disruption within the church. It was that based off of their background and what they knew, that they thought that that's what you were supposed to do. So they needed to be quiet. They needed to be taught the ways of the Lord. They needed to sit and to listen and to stand still and learn. And because of this disorder within the church, it created a lot of confusion. And a lot of lack of peace going on. So I really like the children's version here, ICB. It says, God is not a God of confusion, but of peace. This is true in all the churches of God's people. So, I believe today we're seeing that today. We're seeing lots of voices, and many of these voices, their intentions are good, but they don't have the understanding that is needed, and it's causing and creating confusion and disruptiveness within the church and within God's people to remain united on such a strong topic. So I wasn't going to include all the scriptures there, but at the last minute I felt that we needed to, so that we can discern with our spiritual eyes what is occurring in today's culture. So I would like to say here, and what I'm seeing today in the post, is that when the enemy cannot steal the next generation through abortion, he will instill fear into the mothers to prevent the gift of bearing children. So the past several days I've been seeing posts like, this election decided for me if I will have another child. And I can understand where the fear comes in, and a lot of this is pro-abortion propaganda. And they're truly winning at what they have set out to do. But I see this in this lack of understanding, and it's truly heartbreaking to me. And I'm about to go over some things here, but, if this is you, if this is something that you said, I fear for my daughters. I fear for people having children now. I fear this. I fear that. This election decided that I'm not going to do something as permanent as family plan for another child. My advice for you would be to call your local OB and ask them. Say, if I get pregnant, I really want another child. If I get pregnant and have a baby, if I have a miscarriage or pregnancy complications, will I be denied care at my hospital? I want you to ask the real people in your state, because they are going to say no. They're going to say, no, ma'am. There is no law that will prevent me from providing you with life-saving measures. So I really want you to clarify that with your local OBGYN. What do they know? What do they understand? They will tell you the policies of their hospital, of their emergency department. And I believe that will quickly and effectively eliminate a lot of confusion and fear and lies that's going on today. So I want to talk to you guys about the difference between abortion and miscarriage right now, because this really needs to be discussed. And the more I see it, the more heartbroken I become. So I did some research a couple days ago, yesterday as well, trying to find out, where is all this coming from? That all of a sudden, the past few months, all of a sudden miscarriage and, compassionate care with stillbirths and all these things are being merged into the abortion movement. So I began to kind of do some research. And I started looking at the CDC, and I started looking at North Carolina Department of Health and Human Services about their surveillance reports. So I looked at the CDC abortion surveillance reports because, every year they report documented abortions. So I looked onto those reports, and guess what? Guess what was reported? Only induced abortions were reported. Do you know why? Because those are what we consider as abortions. In the abortion industry, in the medical field, we consider induced abortions abortions. So when you're talking about abortions in the pro-life movement, when you're talking about abortions in lawmaking, it is induced abortions. And that has been the understanding of the medical world for until it wasn't, until politics made it not. So when you go to the CDC, if you want to find out how many abortions have been reported in your area in the country, it's going to give you those numbers, and the numbers is 1 million abortions a year, and these are reported at the CDC, and it is elective abortions that's reported, nothing else. So here is point number one for you here is, the abortion surveillance reports are only elective abortions, because that's what we're talking about in the abortion industry. Number two, North Carolina surveillance reports include separate reports for reported induced abortions, live births, and fetal deaths. So why do they do separate reports? Because they're three separate things. Because reported induced abortions are a separate topic. Live births are separate. Fetal deaths are separate. So I want you to see that not only does the North Carolina Department of Health and Human Services report abortions as induced abortions only, but also the CDC does this as well. So as we're talking about medical terminology, you need to really see how we report this in the medical industry. When we say abortions, we mean elective abortions. So I want to read out some definitions here to you. It comes straight from North Carolina Department of Health and Human Services. It talks about the medical terminology of abortion. It goes into detail what an induced abortion is, a spontaneous abortion is, and how they're reported. So this is straight off the North Carolina Department of Health and Human Services. It says abortion is the premature termination of a pregnancy resulting in or caused by death of the fetus or embryo. Two types are considered in the context of public health reporting. The first is induced abortion, the purposeful interruption of pregnancy with the intention other than to produce a live-born infant or to remove a dead fetus, which does not result in a live birth. Liberalization of North Carolina abortion laws began in 1967, but it was not until 1973 that abortion became available on demand, with the condition it be performed by a licensed physician in a hospital or licensed abortion clinic. Abortion data by mothers, county, and residents became available in 1978. So a spontaneous abortion is an interruption of the pregnancy for some other reason than human choice. Example, a marriage, a miscarriage, or stillbirth. Spontaneous abortions less than 20 weeks gestation are not reportable in North Carolina. Why? Because they're not induced abortions. Stillbirths of 20 plus weeks gestations are reported as fetal deaths. They're not reported as an abortion. They're reported as a fetal death. So here it's talking about medical terminology, okay? So I totally understand I don't understand medical billing, but I understand that the loss of a pregnancy in medical terminology and medical billing is labeled as abortion. I get that. I get when you do a billing code, when they do a diagnosis, if you have a miscarriage, it does say spontaneous abortion, but we do not view that as an abortion within the pro-life abortion laws. We do not view that as an abortion at an abortion clinic, because an elective abortion, the purpose and intent is to end the life of the fetus. Okay? A spontaneous abortion, there is no control in that. That is a miscarriage. That is something that naturally occurs where the woman has no say. She has no control. It happens naturally. So these are two totally different losses, and they're both very traumatic losses. We need to understand that an abortion is a loss and that women will grieve that loss whether we want to acknowledge that or not. I see that every day in my world. I see tears forming of women that have had an abortion. All I need to do is ask what their pregnancy history is, and then they finally get to talk about it, and you immediately see tears in their eyes. Like why? It's because it's traumatic. It is not easy. It is traumatic. And these are two totally separate traumas and losses that propaganda and politics are trying to merge into one, and that's simply not what it is. And it's very upsetting for people on both ends who are trying to process those losses. So let me keep going here. It talks about the abortion rate, which is the number of induced abortions per 1,000 women of reproductive age, 15 to 44. So this talks about how it reports. So when we look at abortion reports for what the abortion clinics report to the state, what the United States reports to the CDC, these are only induced abortions, okay? if the medical world considered miscarriages, ectopic pregnancies, stillbirths, inductions to save the woman's life as abortions, those would all be included in these numbers, and it's simply not the case. So I will give you the links to the CDC, to the North Carolina Department of Health and Human Services, so that you can see with your own eyes that these are not reported in these instances, because the medical world does not view that as an induced abortion. So number 2, there's 3 total topics here. I'm already at minute 20, so I'm going to try to speed it up a little bit. Medical error has been an issue for decades, not just since the overturning of Roe versus Wade. So I'm going to talk about a few things here as far as medical error and negligence. Number 1 is the United States infant mortality rate. This has been known for a very, very long time. The United States is not doing well as a developed country for infant mortality rates and maternal mortality rates. If you Google how the United States is doing as a developed country on their infant mortality rates, you're going to see that there are many, 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 many countries that are doing better than us. And we have over-medicated our country. We have over-vaccinated our country. We are all about pharmaceuticals in our country. You can literally go to the drugstore and get almost whatever you want. We have so much medication available and just all these things available to us, yet our people are chronically ill. So it's no surprise that we could do better as a society in the medical world, and that's just how it is. So I actually was looking at this recently, and I saw a trending article about infant mortality rate, and it says something along the lines of 2022's infant mortality rate is trending up for the first time in decades since the Roe versus Wade overturn. So I saw this, in the midst of election season, right? And how they're trying to link this rise with the Roe versus Wade overturn. Like those laws are causing babies from birth to 1 year old to die. They're trying to link that. So I knew that the infant mortality rates have not been good in the United States. They haven't been in a long time. So I began to look year by year on what that looked like and the trends that were occurring. And, I started in the 1990s, and the infant mortality rates was about 9 babies per 1,000. So that was pretty high. And then it trended down to where we are now, which is about 5. And when I looked at the reasons for the infant mortality rates, the biggest chunk of deaths was because of early or preterm labor. So in the 1990s, the NICUs were not built like they are today. They didn't have the technology that they did. Today, babies very, very early can be born and survive as early as 22 weeks gestation. We've actually just had a client that prematurely had twins at 23 weeks, and sadly her little girl passed away, but her little boy is actually doing exceptionally well. Of course, he's had some difficulties, but we hear stories like this all the time, where babies are able to live very productive lives with little support once they go home, and that's amazing. We have advanced in those ways, and that is why we're seeing the rates decrease since the 1990s. But coming up closer here, we are going to look at the infant rates just really quick. I could actually spend a lot of time on this, but I'm not. So in 2018, the infant deaths were about 566 infant deaths per 100,000. In 2019, it went down a little bit to 558. 558 infant deaths per 100,000 live births. In 2020, so this is when the world shut down. We weren't able to go to the doctor. We weren't able to go to well checks. We weren't able to get checked every 1 month, 2 months, all those well checks we were not able to take our children to because the world shut down. So in 2019, the infant death was 558 per 100,000 live births. In 2020, it went down from 558 to 541. So that was a 2.9 percent decrease in infant mortality rates when we were not able to go to the doctor all the time. 2021, it went back up a little bit to 543. And then we have in 2022, the infant mortality rate went up to 560 infant deaths per live birth, which was a 3.1% increase since 2021. So the abortion industry would love to have you believe that this is because of abortion bans, that babies being born from the ages of birth to 1 year old are dying because of abortion bans. But I would like for you to dig as to what actually happened in the years of 2022, and I will give you a guess as to what I found on the Centers for Disease Control and Prevention. And, you know, regardless of what we feel about these topics, it is something that we need to address, especially when it's new and especially when they're trying to place blame elsewhere. So I will just for your knowledge to see that in June 18th of 2022, the CDC approved COVID-19 vaccination for young children who are at least 6 months old. This means roughly 20 million children in the United States under 5 years are newly eligible for vaccination. With COVID-19 cases rising, many parents are eager to vaccinate their youngest children. So that is something new that happened in 2022 for infants, and it is something that should be addressed, should be looked at, as we should do so when we add new things to the children's schedule. However, that happened in 2022. After that, it went back down to 548, and now it's 534. Deaths per 100,000 live births. So those are things we should look at when we're looking at the infant mortality rate. I also have on here the maternal mortality rate. We know that's high, especially in African American women postpartum. That has been a thing for a long time. It has nothing to do with the abortion bans of 2022. John Hopkins study actually rates that medical errors is the third leading cause of death behind heart disease and cancer. And I will link this as well. And this is a John Hopkins study that was done in 2024. And we've seen this before, where just the medical industry in general has really struggled to keep up. We're doing well in some things, and other things we need to do better in. And I think as we add new things, they should be studied on their effectiveness and how they're helping the people. So the point behind all this is that, issues in the medical world has been an ongoing issue for decades. Nurses are understaffed. Medical doctors are understaffed. There's poor policies, lack of quality care. Medical system is more for temporarily treating the symptoms versus addressing the root problems. The very few and true cases of lack of care for miscarriage treatment is likely one of these stories of medical neglect or error. If it was not an election season, you probably would have never even heard of that case to begin with, but they're pulling it up to cause that fear and confusion that we were talking about. Many stories of women not being able to receive care post-abortion is erroneous, taken out of context, or has valuable information missing. We cannot believe everything we read in mainstream news, unfortunately, and we probably should have learned that by now. You cannot believe every headline that you see on social media, or even in very well-known publications. An example of this, and so many people know about what happened in Georgia in 2022. An example is the abortion pill and self-management, as promoted in the abortion industry, is what caused the death of Candy Miller in Georgia. It was not an abortion ban law that killed her. Her death it definitely was preventable. And it's very sad that this happens. But the abortion industry is responsible for her death. Georgia law does not prosecute women for seeking abortion after the 6-week ban. And this is what she believed, and it was false information. And it wasn't information provided in the law, it was false information provided by the abortion propaganda. She also had a lethal dose of pain medication, which I read was fentanyl in her system. And you see, the abortion industry will promote that abortion pills are safer than Tylenol. and that they can be self-managed at home. And this misleads women into believing that this is a simple thing. It's just like a period. It can happen easy. Bam, bam, it's done. And that's not the case. I have women coming into our office telling me that that is not the case, that 1 or 2 months later, they're still having issues after the abortion pill. When this is done at home and women believe that it's safer than taking Tylenol, these women are having to be their own medical doctors and to determine if what they're experiencing is normal or not normal. And they're having to do this without the help of a medical doctor or medical staff. And that itself is dangerous. Abortion bans didn't do that. The abortion industry did. Amber Thurman, she died from complications of the abortion pill. And a complication of the abortion pill is an incomplete abortion. That is what happened. And from what we are able to gather, it does look like there was medical negligence at the hospital. Do we all know the whole story? No, we only know what the news media is going to let us know. But it does look like it was complications of the abortion pill and medical negligence. Falsifying reports of what Georgia state law actually says very well could have contributed to the delay of care. So information and reports that were not true about the care is probably what led physicians to believe that they couldn't treat her in a timely manner. I believe in transparency for all ends, so that there is no confusion in law between the medical doctors and the lawmakers. This can easily be handled with simple in-service trainings with healthcare professionals on a state-to-state basis. It's been 2 years. I feel by now emergency departments should have their policies and understandings. If there is a lack of understanding between the laws, I believe that education should not only be done once, but annually. As nurses in a hospital, doctors in a hospital, you have to participate in annual education. I believe that should be an important part to clarify these myths, to clarify this misinformation per se, so that the doctors can truly treat their patients. And I am going to read to you state law for Georgia. It clearly states that there are exceptions to this and that miscarriage is not considered an abortion. So I'm going to read this law. I began reading a lot of laws, and again, it can be very confusing because some of them are 48, 50 pages. However, Georgia is one of the most clear that I have seen. So I'm going to read it to you. It's Georgia Code 16-12-144. And it immediately talks about, for the purpose of this law, it says that abortion means the act of using, prescribing, or administering any instrument, substance, device, or other means with the purpose to terminate a pregnancy with the knowledge that termination will, with reasonable likelihood, cause the death of an unborn child. That is what they are calling an abortion. It also says, provided, however, that any such act shall not be considered an abortion if the act is performed with the purpose of 1. Removing a dead unborn child caused by spontaneous abortion. That's pretty clear, right? Or removing an ectopic pregnancy. So this is like the first thing in Georgia law. It's the first thing. It is very clear. Are all state laws as clear? No, I think they should be. And I think that that's something that each lawmaker should work with their states to make that as clear as possible. But for the state of Georgia, it's like the first page. And I don't understand why there's confusion. Well, I know why there's confusion. It's because one side wants to create it, and they have been successful. So in regards to your state, I would recommend reading the law. If you are of childbearing age and are concerned that you won't get the care that you need, read your law. Call your OB and see, what would happen if this were to occur. And I think that would eliminate a lot of fear and anxiety when it comes to family planning. And lastly, we're going to talk about the last point here. And we're almost finished. And thank you for hanging in there, guys. But I feel like this hard topic is very much needed. So lastly, we're going to talk about the hard cases we spend so much time talking about actually account for only 1 to 3% of the 1 million abortions performed yearly in our nation. 1 to 3% are the hard cases of rape, incest, fetal abnormalities, and the danger to the mother's life. This means that at least 97% are for financial or emotional strain or for other undefined reasons. So pretty much 97 to 99% of abortions completed in America are because of inconvenience. They're not because of the hard cases that dominate our abortion discussions. Also, we need to know that most late-term abortions are obtained for the very same elective reasons that earlier abortions are obtained. And I'm going to try to... I'm not going to read this because I'm running out of time here. I am going to put in this article from a pro-life doctor, medical doctor named Ingrid Scott, and she talks about the 10 myths about abortion, and one of them is about the hard cases. Okay, I'll read a little bit of it. All right. One of the most frequent myths about late-term abortion is that it may be necessary to save a woman's life. Don't get me wrong, it is clearly the standard of care for any physician to intervene in a pregnancy that presents a risk to the mother's life, as long as no direct action is taken to terminate the life of the unborn child. However, these life-threatening situations occur far less commonly than one may assume. Some examples are ectopic pregnancies, infection due to extremely premature rupture membranes, severe hypertension, cardiac conditions. The law has never limited interventions in these circumstances, even in countries when an elective abortion is illegal. And it talks about how rare some of those conditions are, like cardiac conditions, blood conditions, things like that. And it also says, it should also be noted that an ectopic pregnancy will inevitably become a miscarriage, as there is no chance that the fetal can reach viability in a location such as a fallopian tube. So intervention for this condition always occurs early in pregnancy, and no physician considers this an abortion. Interventions later in pregnancy are more correctly termed premature parturition. In these cases, the purpose of delivery is not to kill the fetus as an elective abortion, but to save the life of the mother and the life of the fetus, or to save the life of at least one of them. This can be done in such a way, induction or C-section, that the baby's life can be saved if possible. So when they talk about the need for late-term abortions, so a D and E, for the need to save the mother's life. If the mother's life is at risk, a late-term abortion takes 3 to 4 days to complete. It involves dilation. It involves digoxin in the heartbeat to kill the baby's heartbeat. It involves a lot of things. That's a 3 to 4 day process. If a woman is truly experiencing a medical emergency, there is no need to go through all that. They would simply induce the woman into labor or have a C-section. And that is not an abortion. That is life-saving measures to save the woman's life. So my question today is, why target childbearing women? I believe that the answer is the abortion industry wants your votes. 25 to 30% of women have had an abortion in America today. 25 to 30%. These women are in our communities, they are in our churches, they are our neighbors, and these women need healing. They need healing. They need someone to love them and hold their hands and walk them towards the one who can heal them, which is Jesus, right? And I've seen that happen, and it's beautiful. They also not only want to target the women with a history of abortions, they want to target the women who've had a history of pregnancy loss. Because 1 in 4 pregnancies end in miscarriage. So between these groups, there's a lot of female voters that could be swayed due to fear of not receiving medical care. So my conclusion for you today is this. No pro-life laws threaten care for miscarriage, ectopic pregnancy, or prematurely ending the pregnancy due to maternal health concerns. Can we do better learning about our own state laws? Making clear policies and trainings for physicians in each state? Yes, we can. There should be no confusion at all. And we should work together to make sure that there is no confusion. As a matter of fact, APLOG did put in a release. APLOG is American Association of Pro-Life OBGYNs, and they actually asked ACOG, which is the American College of OBGYNs, who's known to be very pro-abortion. They actually called for them to say, hey, let's work together on this terminology. Let's work together so that each state is very clear on what they can and cannot do, because the life of the mother and the baby are important, and we shouldn't neglect either. So I believe that no matter where you stand, we all should seek for clarity of these laws. Our abortion stance should be based on the 97 to 99% of abortions that are completed every day, which is inconvenience. That is the number one reason for abortions today, is inconvenience. Not on the 1 to 3% of hard cases, which is what we have talked about today. Many pro-life laws still allow for abortions for rape and incest, and they all allow for the threat of the mother's life or health. If a woman has conceived out of rape and her state does not allow abortions in that circumstance, she could likely drive to another state, which is what many people are doing in North Carolina right now. North Carolina is actually has been called the abortion destination state because people from other states have driven to North Carolina for abortions. Am I promoting that? No, but I'm saying if someone is a victim of rape and has conceived and has been, has informed consent, knows that that's what they want to do, they could still do that even with abortion bans. They could easily go to another state. Am I promoting that? No, but I'm saying that it's not an absolute no, they can't do it. So my personal belief here is if a woman was raped and truly wants an abortion, I believe that she truly needs to receive informed consent first, because we found that in abortion clinics that just doesn't happen. I know people that have gone to the abortion clinics and they say that, once I was there, I felt like I couldn't back out. I felt like I had to take that pill. I feel like I had to go to that extreme. I feel like I was scared. I had no other option. I believe that women need informed consent. And in order to have informed consent, you need to know what your options are for your pregnancy. And those options are not only abortion. It is adoption and it is parenting. And there's resources to help you with all of them. It's my personal belief that abortion only adds to the trauma of rape. It does not erase it. So with victims of rape, I believe that, it must be very traumatic. Like, absolutely it must be. But what we don't understand is that abortion is also extremely traumatic. Regardless of how that pregnancy ends, that life stays with us as women. That has been scientifically proven through DNA, chemicals in our brain. And abortion does not erase the trauma of rape. It adds to it. It multiplies it. It makes that trauma bigger than what it is. So abortion is not the solution to rape. The solution is finding healing. It's finding healing. And I believe that taking another life does not promote the healing process of a rape victim. And that's just my personal belief, because I've seen the ramification of abortion. We've had a 80-something-year-old woman walk into our office in a cane and saw us for 2 years. 2 years she came to us consistently because of the trauma and the effects of 2 abortions. And she remembers the dates, and she remembers the anniversaries, and she wonders what could have been. I have no children. What could have been if those 2 children were not aborted? What would my life look like now? And women can and will experience that after an abortion, and that is an added trauma. So added traumas do not make the initial one go away. So I think we really need to address that. We need to look at abortion as not a solution, but a trauma. If you have friends that have had an abortion, I think you need to really be there for them and say, hey, when you're ready to talk about that, I'm here for you, because it is a trauma. And it does not erase previous traumas going on. But if the woman believes that she needs to have an abortion, many pro-life states with the ban still allow that. And if they don't, there are others that do. We travel the states all the time for vacations, for jobs. It's a very possible thing that can be done. And because of Roe versus Wade, those laws are now in the hands of the states. So, it's based off of the state law. So it is not completely taken away from a rape victim. So yeah, that's what I have to say about all of that. And I pray that it's been educational. I pray that it's been helpful for the women of the church watching this video. How we should really change our focus on the majority of abortions. The 1 million children that are lost every single year in America because of abortions. We need to focus and put our time and energy on that and supporting the women who are in unplanned pregnancy so that they can choose life. Because many of them want to, but they don't believe in themselves. They don't believe that they can do it. And that's our job as the church, to walk alongside them. That's why our center says that we're not just pro-life, we're pro-abundant life. We care about the mother, we care about the father, and we care about the baby. And we don't just leave them high and dry when that baby's born. We don't just leave them high and dry if they have an abortion. We want to walk with them, help them, love them, and share the gospel to them. And that's what we as the church are called to do. And I believe that the enemy is trying to distract us, confuse us, divide us. And until we as the church just come together and love and talk about these hard things, he will continue to succeed. But if I could just be a small part of someone understanding the whole picture and what it truly looks like, I know that I've done my part. So this video did not end in 20 minutes. I'm at 46 minutes right now, but I think I've organized all this better so that I hope that it is beneficial to the kingdom. So tune in to our next episode I will be interviewing 1 or 2 amazing women in the foster care world, and I'm so excited about that. We will be addressing the phrase, but what about the children in foster care? And I'm just so excited to share that with you guys. And I'm excited. So thank you for tuning in. I love you guys. I will try to put all these sources under the video. And, if you got any questions, feel free to talk to me. I don't know everything, but I want to share what I do know. And we need to share that with love, and we need to talk about it. These things don't have to be taboo. And I think talking about it, understanding it, provides truth. It brings light into the darkness, and it decreases the distraction, the confusion, the division that's going on into the world today. So I love you guys. If you have not subscribed, please do so, and we will see you soon. Bye, guys.